is a blood transfusion required for diverticular bleeding. Imagine your body as a finely tuned machine, and when it loses too much blood from a diverticular bleed, it needs some help to keep running smoothly. Not every case of diverticular bleeding requires a blood transfusion, but it can become necessary depending on how much blood is lost and how the patient is doing overall. Most of the time, diverticular bleeding stops on its own or can be controlled with procedures like endoscopy, which uses a tiny camera and tools to stop the bleeding without surgery. Because of this, many patients do not need a transfusion. However, if the bleeding is severe and causes significant blood loss, leading to anemia or instability in blood pressure and heart rate, a transfusion might be needed. Doctors usually consider a blood transfusion when hemoglobin levels fall below about 7 or 8 grams per deciliter in stable patients. If someone has heart problems or shows signs of shock, the threshold for transfusion might be higher, around 10 grams per deciliter. These decisions are made carefully, based on individual health factors and how the patient responds to initial treatments. Most cases of diverticular bleeding are managed with endoscopic procedures, like clipping or cauterizing the bleeding vessel, which often stops the bleeding without the need for surgery or transfusion. Surgery is only considered if the bleeding is massive or cannot be controlled with less invasive methods, but it carries higher risks. When bleeding is ongoing and severe, or if the patient shows symptoms like dizziness, rapid heartbeat, or very low blood pressure, a transfusion becomes an important part of supportive care. Transfusions can be life-saving, but they are not without risks, such as allergic reactions, infections, or other complications. Because of this, doctors often prefer a cautious approach, giving transfusions only when clearly needed. Besides transfusions, initial treatment includes giving intravenous fluids to help maintain blood pressure and volume. If bleeding continues or reoccurs, repeat endoscopy might be necessary to find and stop the source of bleeding again. Ultimately, the decision to give a blood transfusion is personalized. It depends on how much blood has been lost, the patient's overall health, and how they respond to other treatments. Most people with diverticular bleeding can recover well with endoscopic therapy and supportive care without needing a transfusion. Always remember, if you or someone you know experiences symptoms of significant bleeding, it's crucial to seek medical attention promptly. Healthcare professionals will assess the situation carefully and decide the best course of action to ensure safety and recovery.